If you're tired of feeling depressed and discouraged from depression and want to seek help but really aren't sure which therapy would be helpful for you, I'm going to show you an essential tool that you can use to help you find therapeutic approaches that are effective in treating depression. Now is always the time to start making positive changes in your life. Hi, Dr. Donna Leigh Bliss here. On this channel, I promote optimal mental health and well-being so that you can become the best version of yourself. Depression affects almost 1 in 10 Americans. Common symptoms include feeling discouraged, feeling sad, feeling empty inside, not feeling motivated to face the day, not feeling that your life has any meaning. It can feel very hopeless and bleak sometimes. Given how debilitating depression is going to be, it can be challenging to find what therapy approaches would actually be effective. Given there are so many therapeutic approaches out there, some are good for some issues and not for others, it can be overwhelming. Where do you start? How do you determine if an approach that you heard a friend maybe get exposed to, would that help with your depression or not? So in this video, I'm going to show you a tool that you can use to help you identify therapy approaches that have been found to be effective in treating depression so that you can feel more confident and hopeful about getting help. Evidence-based practice is a process that's used to review, analyze, and translate the latest scientific evidence to help determine which therapeutic approaches are effective in treating a disorder. And through collecting systematic research, we can draw conclusions about what works and what doesn't. And so the good news is that this research has already been done, and you can use it to locate a therapeutic approach that's been found to be effective in treating depression. So I'm going to give you an overview of 3 approaches that evidence-based research has shown to be effective in treating depression. The first is cognitive behavioral therapy. According to the Mayo Clinic, cognitive behavioral therapy is considered by many to be the gold standard in treating depression. The therapeutic approach focuses on our thoughts and beliefs that help create depression or keep depression going. It also focuses on behaviors we engage in, behaviors that can lead to feeling depressed, that help us stay stuck in a depression. And so the therapeutic approach is very much focused on identifying these thoughts and beliefs. Many times they're automatic or we're not aware of them, that actually cause us to see the world in a way where we feel depressed. And by identifying them, we can start learning new beliefs and thoughts and new behaviors that can help us feel much better. I will tell you, in my 30 years of clinical practice as a social worker, I've worked with many different issues, and I've worked with lots and lots of clients that have depression, and I like cognitive behavioral therapy. It's effective, it's easy to understand. It's an approach that clients can work with. They can understand learning about their thinking, seeing how they generalize things as being very negative when they're really not, how they can be pessimistic and project fearful outcomes about the future, even though there's no evidence to support that. I also found it helpful because it gives them a chance to focus on new behaviors they can learn to help them cope with the challenges of life and feel better. So just from my experience, I highly recommend cognitive behavioral therapy as an approach to treat depression. The second approach is interpersonal therapy. Interpersonal therapy sees depression as resulting from interpersonal relationships. So it's a short-term treatment that focuses on how depression impacts these relationships, such as with families, members, and friends. And these relationships are believed to play a role in the onset of depression and in the ongoing symptoms. So in this therapeutic approach, the therapist and client work together to improve 1 or 2 problems that occur in the client's interactions with others. The focus remains on these interpersonal problems throughout treatment. And so the idea is that depressive symptoms will improve if a person can make positive changes in their relationships and increase their level of social support. Now, I've used interpersonal therapy as well. Oftentimes, in combination with cognitive behavioral therapy, and I found the focus on relationships and especially about social support to be very, very helpful in helping my clients. A third evidence-based approach is problem-solving therapy. This is a short-term structured treatment that is based on the premise that the problems of daily life can cause and maintain symptoms of depression. So by learning to identify and work on these problems, depressive symptoms will improve. People who use problem-solving therapy will set specific and realistic goals and ideally gain a sense of control over their lives. So now that you have an idea of which therapeutic approaches have been found based on research to be effective in treating depression, your next question might be, well, how do I go about determining whether the therapist I might work with knows these approaches, if they can help me? So as a bonus, I'm going to offer you some questions that you can ask a therapist, and it'll help you to get on the right track so that you can make an informed decision about who you want to work with. So the first question, and it's a question that I get asked quite often, is what are my experiences in treating depression? Clients want to know, have I worked with depression? They want to understand, can I help them? And so when they have confidence that a therapist has experience in an issue, they're more likely going to enter therapy. So ask a prospective therapist, what are their experiences? Maybe they don't focus a lot on depression, and so they might not be a good fit for you. But maybe they do. So the next question is to ask them what therapeutic approach they use. And oftentimes they'll tell you, like when clients ask me, I talk about cognitive behavioral therapy and how effective it's been. But you may have a prospective therapist that uses an approach you haven't heard of, that you don't know is evidence-based or not. Now that doesn't necessarily mean it wouldn't be a good approach to use. You'd want to learn more about it and how effective they think it has been. So it's helpful to talk to them about their approaches, ask them how it's helped other clients, and they'll give you that feedback, and that should help to increase your confidence in making a decision about whether this would be a good therapist to work with or not. Finally, you can ask them directly if they use cognitive behavioral therapy. I have clients that ask me that question as well. And if the therapist says yes, you can again talk with them about how effective it's been, whether they think it would be helpful for you. And if they say no, you can then again talk to them about the approach they do use and then make a decision about whether you want to work with them or not. So these simple questions are really nice icebreakers, especially if you've not been in therapy before. It can be overwhelming and a little bit intimidating, and there's a tendency to be afraid to ask a therapist these kinds of questions. But I'm going to tell you, a good therapist will always welcome your questions, and they'll give you thorough answers so that you can make an informed decision. So never hesitate to use these questions when you're talking to a prospective therapist. It'll help you out quite a bit in your decision making. Depression is a serious issue that negatively impacts the lives of people. The good news is that there are treatment options that are available that help, and I've shared with you today 3 that have been found by research to be effective in treating depression. That means you can be confident that if you're seeing a therapist that uses any one of those approaches, that it can be effective for you too. Thank you for watching the video. I've included a list of resources in the description below that you can use that you'll find helpful. I encourage you to click on the subscribe button if you'd like to receive notification of future videos that I will be publishing on improving mental health and well-being. Remember, now is always the time to start taking positive action to make changes in your life. I'll see you next time.